Hey everyone, in this video, we're going to be discussing the different types of ICU care and their indications. When someone is critically ill, they may require specialized care in an intensive care unit, or ICU. There are different types of ICU care that are designed to meet the specific needs of the patient, depending on their condition. One of the most common types of ICU care is medical ICU or MICU. This type of ICU is for patients who have a medical condition such as pneumonia, sepsis or heart failure. The medical team in the MICU includes critical care physicians, nurses and other specialists who work together to provide the best care for the patient. Another common type of ICU is a surgical ICU or SICU. This type of ICU is for patients who have had surgery and require close monitoring and care post-surgery. The surgical team in the SICU includes surgeons, anesthesiologists, nurses and other specialists who work together to provide the best care for the patient. A third type of ICU is a cardiac ICU or CCU. This type of ICU is for patients who have a cardiac condition such as a heart attack or heart failure. The cardiac team in the CCU includes cardiologists, nurses and other specialists who work together to provide the best care for the patient. Lastly, there is a neuro ICU or NICU, which is for patients with neurological conditions such as a stroke, brain injury or severe head injury. The neuro team in the NICU includes neurologists, neurosurgeons, nurses and other specialists who work together to provide the best care for the patient. It's important to note that ICU care is individualized and tailored to the patient's specific needs, and the choice of ICU will depend on the patient's condition and the care they require. In conclusion, when someone is critically ill, they may require specialized care in an intensive care unit, or ICU. There are different types of ICU care such as medical ICU, surgical ICU, cardiac ICU and neuro ICU. Each type of ICU is designed to meet the specific needs of the patient depending on their condition and the care they require, and the team of specialists in each ICU work together to provide the best care possible. It's important to note that patient care is individualized, and the choice of ICU will depend on the patient's condition and the care they require. Additionally, it's important to understand that being in the ICU can be a stressful and overwhelming experience for patients and their families. The healthcare team in the ICU will work closely with the patient and their loved ones to ensure they understand the patient's condition and the care they are receiving. They will also provide support and guidance throughout the process. It's also worth mentioning that ICU care is often associated with higher costs and prolonged hospital stays, which is why the healthcare team will work to provide the best care possible and help patients recover as quickly as possible. So, if you or someone you know is in need of ICU care, it's important to know that there are different types of ICU available, each with its own set of specialists who are dedicated to providing the best care possible. If you have any questions or concerns, don't hesitate to ask the healthcare team. Thanks for watching.